Dr. Dan Purser, danpursermd.com. I'm here to give you a new approach to endometriosis. It's a little bit different than the last approach. Last time I did this and talked about endometriosis. So I'm going to broaden your horizons, give you some more options, talk to you about what I do and what I see. And I've got Brecken to my left. Brecken, you're on camera now?
Sometimes.
Sometimes. Your Ceramax hat on?
I do have my Ceramax hat
I
on.
had one of those. Those are cool.
You do have one, don't you?
I do. I think Dandy the dog took it.
Oh.
She's wearing it in the backyard. And cousin Will is working all the equipment.
I am. You can't see me, though.
Jackson went to Florida to take care of some business. And now we're here just chatting away.
Yeah.
Hey, so I'm a little hoarse from travel and stuff like that too. So let's dig into this endometriosis. Oh, you're gonna play the theme song.
I am. I don't know how to play.
Can you tap dance the theme song?
That's my nails.
Oh, you're really tap dancing.
Do some ASMR. No. When Jackson gets back, he'll do the theme song.
Jackson will do the theme song. Will, can you learn to play an instrument like a tuba or a sousaphone or?
I played the saxophone when I was in 6th grade.
I didn't know that.
I did. And I played the trumpet in 7th grade.
I didn't
You
know
come
that.
from a long line of purser saxophone players, but you're not a purser.
So I do not come from a line of purser saxophone players at all.
Not one bit.
I'd be a lot better if I did, I'm sure.
Yeah, it's in our genes. I swear. Okay. God, I need some more water. All this talk's making me nervous.
No worries. So endometriosis, that's what we're talking about, right?
I believe it is.
What is endometriosis?
I don't have any idea. No, I do.
Oh, you don't?
So women, right before their cycle starts every month, they should mount a large outpouring of progesterone or progesterone response. And it kind of eases the cycle, makes it lighter, makes it less, makes it only a few days, all that when it's optimal. Some women don't make enough progesterone.
Do you want to pull your mic closer for you, Dan?
Yep.
Thank you.
Is that better?
Yeah, that's great.
Some women don't make enough progesterone. And so they can't mount a proper progesterone response during that cycle, during that outpouring of progesterone. They can't do it. Some women are born with only half of their receptors. They have their alpha receptors, but not their beta progesterone receptors. So not enough progesterone can get into the endometrium, and it just is miserable for them. 1 out of 200 women with endometriosis fall into that category. The other 199 are they just don't make enough progesterone. And finding out the reason why they don't make enough progesterone is the trick. Or giving them lots of natural progesterone is the trick. I like to try and find out why they're not making it.
Yeah.
Because it's cheaper for them in the long run if we figure that out.
Find the root cause, too.
Really dig into the root cause. Though natural progesterone can replace, and I have about 2,000 patients that take natural progesterone, but they're most of them are postmenopausal. I have about 800 that I treat for endometriosis, and they take some natural progesterone, usually not all.
That's me.
What?
I'm one of those, right?
Are you what? No, I know you are. I know. You should never admit that on air.
Oh, well, I just did.
Yeah, you're going to ruin your social media response.
You said there were 2 kinds. So what are those 2 that you deal with of endo?
So there are 2 causes of endometriosis. First is severe. I mean, it's like a nuclear bomb endometriosis. These women just have terrible endometriosis problems, need repeat surgeries, all that. I would say they don't need the repeat surgeries. There's other ways you can deal with them with less trauma. And so these women, I have taken care of quite a few of them. And if I can tell you, I have 12 of them I take care of.
Yeah.
So, which fits with my number of about 2,500 patients I deal with. I said 2,000, but it's closer to 2,500 women I treat for endometriosis and low progesterone. So they need a lot of natural progesterone, like 5 to 10 times more than the usual endometriosis cases. And they need a lot of Ceramax too for their pelvic pain. Not a lot, but they need it during that time badly.
Yeah.
So 2 major game changers for them, natural progesterone and Ceramax. They don't need to take pain meds, don't need to take ibuprofen, all that. Occasionally they will, but not all the time. They can get by with Ceramax and lots of natural progesterone, and we can hopefully get it under control. We do this all the time. It doesn't always work, but it mostly works.
Yeah.
So,
and how does the extra progesterone in their body circulating actually help make these women feel better? What does it do?
well, they're missing half the receptors, so that's a good question, but it's like insulin resistance. When you have less insulin receptors that are functional, then the doctors increase the doses of the insulin medications, because insulin receptors and progesterone receptors both aren't always in the position of functionality where they're ready to grab an insulin molecule or a progesterone molecule. They intermittently go there. And if there's no progesterone available, they'll shut down, curl up, get sad again, and eventually they'll pop open again like a flower and can take a progesterone or an insulin molecule. But if you have a lot of excess progesterone floating around in their system, natural progesterone is totally harmless. It really is. It doesn't cause any cancers, doesn't do anything. For good Lord, read my book on progesterone. It was number 1 3 times on Amazon for a reason. I've never been sued for it or anything. It's completely referenced to. It just does not cause cancer or anything. It doesn't cause clots. Nothing. Zero.
Yeah.
It does make you sleepy and feel like you're drunk sometimes, but that's about it. And it gets rid of hot flashes, night sweats, and endometriosis. Okay, enough of that. But if you have enough progesterone molecules floating around and they're crowding to attach to that receptor, pops open, then immediately you grab a progesterone molecule. That's how it helps. You're embedding 2 to 3 times the number they usually do of natural progesterone into their cells through the alpha receptor.
Gotcha.
So, or through the insulin receptor, it takes in more insulin because, again, it's kind of random luck if an insulin molecule is around there that it can attach to. So you want to have it crowded with insulin or crowded with progesterone. Does that make sense?
Yeah, that's really interesting, actually.
I just lost my line. Hang on.
You're good.
Actually, I have a doctor in Spain who feeds me all this information. I'm kidding.
From Spain, of all places, too.
That was funny, wasn't it? Mm-hmm. Came out of the blue on that one.
And you mentioned earlier, like, what about with pain and inflammation? Does the progesterone help with that, or what?
It does. It reduces pain. It reduces inflammation. And if it doesn't do enough, add Ceramax, especially around the time of your cycle. Ceramax, we've done some really good preclinical trials. We know it works for this. So you got to try it. Of course, we haven't gotten FDA approval to say that, so I'm not going to say that. We don't know anything about if it works for this or not.
Side eyes.
Yeah, I don't know. I don't know if it works for it. But it is FDA registered OTC. You just rub it over your pelvis, see what happens.
So those are for
no promises.
Those are the 2 things, natural progesterone and Ceramax, that you should do if you have that severe case of endometriosis.
Yeah, but you're talking about a lot of natural progesterone.
Yeah.
Those 12 women take anywhere from 8 to 15 or 17 natural progesterone RDTs a night.
And that's like 200 mgs each, right?
200 milligrams each.
Yeah.
And you can tell, I can tell when I found one right away because I'll write a prescription for progesterone. We'll talk about it. I'll say, start low, go slow. Start with 1, play around with. You might need 2, maybe at most 3. And literally, I check back on them 2 weeks later, and they're like, I'm good. I feel really good. I'm like, how many progesterone are you taking, 1 or 2? They're like, 12. I'm like, what? Can I take more? Though I might want to take a little more. I'm like, wait, you said 12? Yeah. Is that a problem? I'm like, no, but you have severe endometriosis. You're missing beta receptors.
Yeah.
And I explained it to him, have him look at literature, stuff like that. It's kind of the easy, cheap way to figure it out. It's not that cheap, but that's a lot of progesterone. You better either own a bank or get a job at a bank or become a bank robber to buy it. But we have ways of mixing and matching. Getting you on some generic Prometrium with a good RX card is pretty cheap. That could help take up a lot of the pain of that all those natural progesterone RDTs away.
Yeah. So what about the more common kind of endo? What do you do?
The much more common kind of endometriosis is also a lot more complicated to treat, though it's less severe.
Less complicated? Or
it's more complicated.
How come?
because I can't save the women money on progesterone other than maybe mixing and matching prescriptions and seeing if their insurance will pick some of it up or something. And I'm not very good at that because I haven't dealt with insurance for 20 years. Nor do I want to, but I will help. And so that's why I use GoodRx cards and stuff like that. But these women, I need to look at a number of different things to try and keep them from having to take a lot of natural progesterone all their life. So there's just steps I do with this. There's ways to treat them very naturally and help them make their own progesterone.
Well, isn't it usually caused more by like genetic errors or nutritional deficiencies or?
I think it definitely is. So the approach I use with these patients, I first check serum progesterone levels if they want. I usually don't need to if they tell me that it's severe endometriosis or they have endometriosis. I'll just go, it's low. You're not mounting a good response. We can look. We can spend literally thousands of dollars looking, but we don't have to. Next thing I'll do is I want to see where their methylation errors are. We can either do our foundation methylation test, which is isn't it a couple hundred, 250 or
Yeah, something around there.
yeah, it's cheap and it's fast. And within 2 weeks we have the results back.
Yeah.
Or if you've already done a 23andMe, if you haven't done one, it takes 8 to 10 weeks to get it back. Don't use your real name or date of birth. You know my rules on that. Get it. You want to link it to an imputed NutriHack or complete NutriHacker for $37. Try and do it all on a holiday because 23andme.com marks their test down a lot on holidays for some bizarre reason. So wait until a holiday, buy it up. And you got Halloween, Thanksgiving, and Christmas coming. So lots of good holidays. You get big discounts. But then it takes 8 to 10 weeks to get the results back. And then you want to link it to NutriHacker.com. Get the complete NutriHacker for $37. The next day after, they'll send you an imputed. Go back and look at this video if you didn't get all that in your notes, but that's what you want to do. And I want to see the imputed version. Email that to us. Or you can do a foundation methylation for about the same or less and get it back in 10 days. And it'll tell me all your methylation errors, which is really the only thing I found that counts so far with this problem. Every bad endometriosis or endometriosis case I see, not the severe ones, but all the rest have bad MTHFR methylation errors. I don't know why, but that's all I found in the last 2-3 years when I really started digging into it. I think I know why it causes endometriosis, and there may be some other genetic errors, SNPs that I don't know about, but I'm looking, I'm watching. I'm going to try and figure it out. So, but I think this is it. So I check their serum progesterone levels. I check genetic testing. Then I treat all that. The biggest deal, we do that vitamin deficiency test, the intracellular vitamins, minerals, amino acids, antioxidants, called a CMA with redox. It's critical. It's $550, but it'll save your life. I probably did 10 of those last week to patients because they came in with all these massive amounts of problems. It's all vitamin deficiencies. How does a 34-year-old girl without cancer or anything just be falling apart and exhausted all the time? And these endometriosis cases, they're all really tired. Do you know why?
They're not getting any nutrients. They're not getting
They have
anything.
vitamin deficiencies.
Yeah.
Also, those heavy periods puts them in a death spiral. They just get worse. Vitamin deficiencies caused by their periods. They get severe iron deficiencies. So the two most common vitamin deficiencies I see are zinc and B12. And that highly affects your ability to make hormones and causes massive fatigue. Without zinc, you won't make thyroid.
Man.
So, and the third most is iron deficiency. Intracellular iron. They've had their iron levels checked, but intracellular is a lot more accurate with iron. That's crazy how good that test is. If you're lightheaded, wobbly, when you stand up and like, what is the matter with you? It's been going on for months. Get that CNA with redox. Call our office. Probably be an intracellular iron deficiency. You could try iron. Maybe get Ferrocal. We can put our link in there for Ferrocal.
Yeah.
That's that food, chelated ferritin I like that I took. Got rid of I donated blood, got rid of my iron deficiency. It's ridiculous. I kept thinking I had a brain tumor or something. Like when I had knee cancer, it was just osteoarthritis in my knee, really. I'm an idiot.
He always thinks the worst.
I am an idiot. Yep. Yeah. So, and then the easy pain control with the Ceramax. It's a FDA registered OTC by my company, AO Biologics, just apply topically over your pelvis for pain. Oh, yeah. I forgot to close that.
So those are the only labs that these women need? That's what you would recommend?
I would. If they want to check their iron too, they can do all that, get it through direct lab, but I don't know. I wouldn't. Save your money. If you're wobbly and lightheaded, you probably have an iron deficiency. Almost undoubtedly. So if you think you got POTS, do the intracellular vitamin panel first, too, by the way. I know this is not about POTS, but I'm telling you, I see deficiencies with that all the time, and we correct the POTS all the time. So, and they don't really have POTS. I don't know what they have. Maybe they have the symptoms of POTS. Is that POTS? I don't know. I think POTS, you're just missing intracellular vitamin deficiencies.
Yeah.
I should give that a new name.
A new name.
Knuckleheads missing intracellular vitamin. No, okay. Well, I've missed stuff before. So labs for endometriosis. Number one, you might want to get a serum progesterone level. Number two, genetic tests, like I said. Number three, the intracellular vitamin levels. That's our super cold test. And these results allow me to treat you optimally for endometriosis and to most appropriately deal with your root cause of the disease.
So why do those? Why not just go on a birth control pill or do something
I already
like
said
that?
it, 250% increased risk of pregnancy. If you have a lot of methylation errors.
Pregnancy?
Sorry, cancer, breast cancer. Pregnancy is far better than breast cancer. Sorry, thanks for catching that.
That's hilarious.
That'd have been horrible.
250 increased risk for pregnancy is what you said.
Yeah, I know. I'm a dork. 250% increased risk. Read the package inserts if you don't believe me. They spell it right out to you. You know why? So you can't ever sue them. They'll go, you're an idiot. Isn't all the package inserts? You should read them, and you can't sue us for breast cancer. Go away.
Crazy.
Also, clots, strokes, heart attacks, pulmonary embolism, big time if you have a lot of methylation errors. Tons of literature on that, too. So if you have MTHFR or some other methylation errors, you already know you can't take birth control pills because it causes you massive inflammation and makes you feel crazy. So, and if you feel that way, when you tried birth control pills 7 years ago and you took them for 2 months, you couldn't do them any longer, that's why. Get your methylation errors checked. And if you have endometriosis, get them checked. You just use the foundation methylation in our office or the 23andMe. Those are your two best options. So
I feel like at one point I've heard you say that something when you start birth control pills, even at the age of like 18, there's an even higher increased risk.
yeah, I said a minute ago, didn't I? Oh, did I?
I think you did.
If you get this, I know it's a common thing for doctors to do. My daughter's high school, I won't name it, but she'd come home and go, I think I have these crazy periods. And we're like, take more progesterone. So she did, and it fixed it. But she said, yeah, but all my friends are on birth control pills. I'm like, you're 15. She said, they all take them, and none of them are sexually active. They just take them. I'm like, oh, my God. Because there's a study done in Finland originally, and it's linked in the references in my progesterone book and my breast cancer patient survival guide book. Both have been number one on Amazon more than once. And for weeks at a time. And the Finland study showed, because they have a very controlled, non-mobile population. When you grow up in a village in Finland, you're going to stay there forever. You will live and die in that village. And you'll take your birth control pills there all your life, or whatever. They found that the birth control pills in girls prior to age 19 caused a 500% increased risk of death from breast cancer, lifetime risk of death from breast cancer. 500% increase, not 250, 500. And it's not getting breast cancer, it's risk of death from breast cancer. So everyone was shocked at the results in Europe. They repeated the study in Sweden in another village under very controlled circumstances and very careful data collection. And guess what they found? The same. 500% increased risk of death from breast cancer if you start birth control pills prior to age 19. It's beyond shocking. It's hard to get that information here in the U.S. And find it, but it is available in my books. So they'll probably disappear now off somewhere, Amazon or somewhere. Not because there's someone's buying them. Okay. For women with bad methylation errors, they can't break down birth control pills properly. That's why they get crazy or have horrible inflammation and pain on birth control pills. They cannot break them down properly.
Man.
You don't make enough glutathione, your methylation cycle is all screwed up. It will make you nuts. And you'll have a big risk for stroke, heart attack, clot, or pulmonary embolism, which is kind of all the same.
Yeah.
So we got to be careful with those. Watch your daughters, too, when they take birth control pills. If they start acting completely off the wall, crazy nuts, psycho, get them off the birth control pill. It's wrong for them.
So should you get progesterone levels checked?
It's plus minus. If you got bad endometriosis, what am I going to do? Not treat you if your progesterone level looks kind of normal? I'm going to treat you.
Yeah.
So, you know what? Good doctors will treat and listen to the patient and their results and their symptoms versus lab results. Lab results are always a very secondary thing, and I will never contravene my clinical judgment or diagnostic judgment on a patient because the labs might say otherwise a little. I'll trust my gut in the patient more than I'll trust a piece of paper. I think most of my patients know that. Mm-hmm. It's one of the reasons I think they like me, but I don't know that. I don't know if they like me.
No, they do.
I don't have that many that like me. They're only 60,000. Would y'all tell a friend so they can like me too? So it gives us 120. Mm-hmm. And this isn't a paid account.
No.
What is that called? Monetizing your account?
Yeah.
We've never done that.
No, we just are here to give information to you guys.
Yeah, I'm not doing this for money or fame. Okay, fame.
Does low progesterone cause increased inflammation?
Yep. But also the vitamin deficiencies that probably cause the low progesterone are probably really causing the inflammation. But those together can cause some pretty bad inflammation. High CRP, high AHS-CRP, that kind of stuff. And if you have bad methylation errors, you could have significantly high homocysteine levels, which is a major stroke, heart attack risk for young people.
Yeah.
And there's other things that cause that now. We'll just leave that right there. Okay, moving on.
With those, there's other options than just taking a prescription progesterone, right?
Yeah, there's PP from YLEO. Let me be really tacit about that. P plus from YLEO, super good. There's progesterone from Designs for Health, DFH. I'm giving away 3 bottles of that tonight just for fun, along with 3 signed books for the people who have the best questions at the end of this.
So ask your questions now so we can get you.
Yeah, ask your questions now, please. Progesterone is freaking amazing. It's hard to get right now. I understand. Everything's hard to get right now.
Yeah, the world's
I just have a lot of it in my office. Probably shouldn't have said that.
Stocked up.
Now our office will be broken into by crazed women having hot flashes.
What do you usually see with genetic
A
testing?
lot of methylation errors.
Yeah, you've mentioned that a lot.
Yeah. MTHFR. Bad MTHFR. Worse the endo, the worse the MTHFR.
That's crazy, actually.
Yeah.
How do you treat that?
With a baseline methylation support. There's a lot of them out there. We think we have the best too. MTHFR Renew, MTHFR Endure. I'll usually start patients, if they have a lot of C677T error, they're going to get Renew more than they'll get Endure. If they have any A1298C errors like I have, they'll get the Endure probably. It's harder to overmethylate on Endure.
Yeah,
So,
I agree with that.
yeah. What do you take?
I take Endure.
How many? 12?
I rotate, so like one day I'll take 1 and the next day I'll take 2.
Really?
Because I'm kind of I've leveled out at a good
Take
base
more.
level. I
Take
don't
more.
need more.
Take 7.
No.
I know I take 3 every day still.
Yeah.
Ever since
You're the man.
Yeah.
I love you, man.
I went through Renew, like, the whole start low, go slow thing with Renew, and then switched over to taking 3 a day with Endora, and I've just stayed there.
I take a massive dose. I take half a tiny bite.
Yeah, I was like, you don't take a massive dose.
It's equal to 1/4 of an Endure capsule. It's ridiculous. I only have 3 errors, and I have A1298C.
Yeah.
Thank you, God, for giving me that one. So, or my ancient
He
ancestors.
gave you a good empty Jafar, but
No, I mean, I wish I did have it at all.
mm-hmm.
So, yeah. I just overmethylate if I take more than a half.
Mm-hmm.
So, but I take cyanocobalamin 3 times a week too.
Do you take Sino?
Oh man, it makes me feel good.
The Sino one.
Yeah.
How come?
It just works with my genetics. I
Yeah.
also take folic acid a couple of days a week. So, because I overmethylate if I do anything more. And I feel really sharp. My B12 and folate intracellular levels are normal.
That's
That's
awesome.
incredible. They're optimized. So,
You mentioned earlier with vitamin deficiencies, you commonly see like zinc and B12, but what else do you usually see with these endo cases?
zinc, B12, folate, B9, which is B9, L-serine, L-glutamine, amino acid ones. Those are all methylation. Those are all MTHFR deficiencies. MTHFR blocks your ability to manufacture or create or absorb certain key nutrients. And there it is. Methylation errors will do that. If you don't believe me, look at Folar 1, Folar 2, Folar 3, FOLR1, FOLR2, FOLR3. Google search those. Those all code or blueprints for folate receptor type 1, which was the original one we had in the human body, the oldest one they think. It's for methylfolate, natural folates. Folar 2 is for folic acid, man-made. Came along about, we don't know, it's this is newer in our genetics, they think that. And Folar 3 is for food folates and other folates. So, and if any of those are screwed up, what I commonly see here in American people, especially in Utah, they have Folar 2 errors like crazy.
Yeah.
They're homozygous. Tons of people are homozygous for Folar 2. They can't absorb folic acid. So when it gets in their system, it just floats around and does nothing other than inflammation. So that's why processed foods are bad if they have folic acid in it. And it's giving you a gut ache or weird feelings when you eat it because you don't have any Folar 2 receptors. Can't absorb folic acid. So
Super interesting.
zinc and B12 are the most
Prominent.
most common deficiencies, and some of the worst ones to actually have. They're miserable. Intracellular iron deficiency is probably the third.
Yeah, you said that earlier, huh?
Yeah.
It's crazy. What are the symptoms, or what do these
So
symptoms
zinc
cause?
deficiencies in women usually cause hair loss, low thyroid production, thyroid receptor dysfunction, and hair loss. If you don't believe me, go to PubMed, look up zinc and the word alopecia, ALLOPECIA. It's really hair loss in women, but they can't explain it. I can explain it. It's a zinc deficiency. Zinc deficiency causes alopecia. You also see pictures on there. If you have friends with bad hair loss, tell them to take zinc. If that still doesn't work, it's usually a vitamin deficiency causing their hair loss. Have them get a CNA with redox if they really want to figure it out.
Yeah.
I'd say it works. I'd say 2 times in the last 10 years it hasn't worked. I think they really have some kind of alopecia and I can't figure it out.
Yeah.
But it's not zinc or B12.
It's so crazy.
B12 deficiencies cause immense fatigue, anemias, just horrible fatigue, depression. They both do that, but B12 is the worst. And iron deficiency makes you wobbly, lightheaded when you stand up. And your room's swaying and you're like, what did I got a brain tumor? That's what I kept saying, but I was wrong. Wasn't a brain tumor.
No.
Wasn't even a knee tumor. No, never mind. Okay.
Well, what's the root cause of like a B12 deficiency? Is there something even deeper?
MTHFR.
Okay. Makes
Yeah.
sense.
Yeah, you can't properly absorb certain forms of B12. That's why there's 5 different ones out there, and or 4 different ones. I tend to use them all.
Yeah.
So in certain situations, I'll change it up. There's adenosine, there's hydroxy, there's cyanocobalamin, which is made with cyanide. That's fun. But sometimes it's all you can absorb. So, and there's methyl B12. And someone who knows your genetics should be able to tell you which is your best option.
Yeah.
So there it is. I treat the vitamin deficiencies. I treat any other genetic errors that we need to treat. I treat, I'll give you natural progesterone for as long as you need it. Hopefully you'll start making your own, which is ideal. And so if you're young and have severe endometriosis, this is just a good, or not severe. Severe's a whole other cat. But if you have bad endometriosis and want to help it, these are the best things you can do. Or you can take birth control pills, have fun. Yeah. You'll still be tired because you haven't dealt with your vitamin deficiencies. So you know what I ask patients when they come in and they're like, I have all these issues. I'm going to die. And I'm like, are you tired? And they're like, what? I'm like, are you tired? I'm exhausted all the time. All the time? Yeah. Day and night. Yeah. You get up in the morning, you're still tired. Yeah, I feel horrible. Okay, you have vitamin deficiencies. We'll figure it out. They're like, what? Yeah, but it's always that way. So let me go over the proper test one more time. So you have this down. Serum progesterone level if you want. That's optional. Foundation methylation kit for genetics, you get it from my office. Or if you've done a 23andMe, dig through all that. CMA with a redox panel, massively important. Serum X for the pain. And if you need it, natural progesterone prescriptions.
That's it.
There it is. Or you can try Progestin or Progestin Plus. Ask away, ask your questions.
Yeah.
Team Purser out there, ask your questions. Here we are.
This woman said, a 14-year-old with bad cramps can't concentrate. Could this be endometriosis?
Or bad PMS.
Yeah.
Get if they're young living, get PP. If they're try that with it. If they're not young living, try Progestin.
How do you tell the difference between endometriosis and bad PMS? Or do they correlate?
They're pretty much the same thing.
Yeah.
She's probably got vitamin deficiencies. And that's why she's getting the cramps and severe periods. I know you feed her good. You got her on a great diet, all that. Still, I'm going to tell you, she's still got vitamin deficiencies. You got to figure them out. That way it ends it, and you can take care of this problem for the next 4 or 5 years until she gets more vitamin deficiencies.
Yeah.
That's another goose chase.
Sorry, I'm reading all these. What about, this is not related to endo, but this is interesting. Is zinc deficiency, is that for men as well with alopecia commonly? Or do you find it's women?
99.9999% of men have male pattern baldness. Trust me, I know that.
Looks to the camera.
So women, 99.999% have vitamin deficiencies,
Gotcha.
causing their hair loss. Do you understand that? There's a really good book called The Bald Truth about women's hair loss. It's hard to find, but when you're in a plastic surgery, it was really critical. Given the Bible, and you know what? I'll give you the punchline. I've read the book 2 or 3 times, but I can summarize it in 2 words: vitamin deficiency. There it is. Find out that vitamin deficiency, and you'll cure the hair loss.
It's amazing.
Yeah.
What if you have a high ESR and high CRP? Could that be related to low progesterone?
It could be, but also in Japanese studies, weirdly, PQQ will lower CRP and possibly ESR by 90%. So you may have a intracellular or PQQ deficiency. If you have memory problems and your word search problems and word acuity problems and all that, look it all up. But if you can't draw a clock very well, that's a bad sign. But you need to get some more brain support and try it. Try 3 a day for a while, in case you got that deficiency. It's cheaper than getting the test. And if you notice memory improvement, all that, and then it'll drop your CRP. It works. The studies were awesome. Those are FDA level, peer-reviewed, validated studies that Mitsubishi did on that. I think it's Maypro that may have funded that, but their subsidiary, but who we licensed it through. But that stuff will kill CRP level. It'll nuke them. Just drops them like a stone. Gets rid of that inflammation. Stroke risk too.
It's awesome. This lady, she's a friend who's had 2 recent miscarriages after having 4 live births. Her last miscarriage was twins. Her hair is starting to fall out.
Vitamin.
Yeah, she was going to say, where does she start?
Get a
Vitamins.
CMA with Redox.
Yeah, because the babies suck
Yeah.
the life out of them too, don't they?
Yeah, babies just need a lot of vitamins, and I deal with this all the time. I have the IVF failure patients, I call them. They come in because they failed 3 IVFs or 4 IVFs. In Utah, can you imagine? That's expensive. It's $12,500, $12,000 here. That's still, they spent $50,000 and not had a kid, or 37, 38. They sold their truck, sold their house, sold their dog, sold their first child, and they still can't have a second child. And they're just miserable. And I'm like, quit spending the money, stop it. Let's take a vitamin panel. It comes back horrible. And then inevitably they get pregnant.
It's crazy.
So, yeah.
Crazy.
Cheaper than the IVF. Don't go get an IVF unless you have some kind of antibody problem. Got an antibody problem, I can't fix that. But if you're tired and fatigued and can't get pregnant, and your periods are wonky, get a CNA with Redox. Call my office. We'll send it. I'll review it with you. We'll get it fixed. I'll guide you on it.
It's awesome. Are there any foods that you recommend staying away from with endo, or any that would help?
I really like strawberry milkshakes with that big cheeseburger. Well, never mind. I don't know.
That's what you like.
No, you know what? This is a bizarre answer. I got to tell you something that might help. Sizzler, the salad bar. Hit it once a week and eat every fruit and vegetable on there. Freaking, you'll have 1 million vitamins in you. Once a week. I think that'd cure the world. Are they the only ones that still have a salad bar?
I'm sure there's other places. with a salad
Maybe,
bar.
but not in Utah.
There's
So-
like 1 Sizzler left in Utah too.
Really?
Maybe 2.
That's horrible.
Yeah.
That's a national crisis.
Is it?
Gary Young loved Sizzler. He loved, he and I ate there. He loved, that buffet. What's the big buffet here in Utah?
Tucanos?
No.
They have a salad bar.
Yeah, they do.
Oh, that's true. Well, now you mentioned it. Takata. Yeah. Eat a salad bar once a week. Everything
Like-
on it.
Sweet tomato. Are you talking about like Chuckarama or something like that?
Don't ever say it like
yeah.
that again.
Oh, sorry.
No, it's that family one that's around here.
Like Golden Corral.
Golden Corral. Gary loved Golden Corral. I love Gary, and he loved Golden Corral. I grew up in Oklahoma. He's my man.
It's so funny. This
It's
is an
scary.
interesting question. Is there a difference between natural progesterone and prescription progesterone?
Usually. But no, you can't. From that question, I couldn't tell you. But yeah, natural progesterone usually has to be compounded, though there is prometrium and generic prometrium. Everything beyond what I just told you is not natural. It's synthetic. It's progestational agents. Doctors will say, this is natural progesterone. Those are called progestins. They are not your friend. That doctor might be your friend, but those are not your friend. So don't take them. 250% minimum increase in breast cancer risk. Clot, stroke risk through the roof, massive. That's why doctors confuse it with natural all the time. They go, that natural progesterone will cause you strokes and clots and all. No, it's the synthetic version that will. Yeah, yam-based natural progesterone. Yeah, no.
So yams would be good to eat if you want to increase your progesterone,
No,
potentially.
doesn't really work quite that way. It's not a conversion way in your body.
You would hope.
Yeah, I wish.
Once endometriosis exists in your body, can it be resolved? Or is it forever
Yeah, I do
dead?
it all the time.
Okay.
You kidding me? You can get rid of that inflammation. You don't. You don't have a deficiency in laser procedures on your pelvis. I don't know.
Some might. No, I'm just kidding.
It's a vitamin deficiency and progesterone deficiency. And Ceramax will help get rid of the inflammation and pain. Mainly the pain.
Sorry.
If you haven't tried it, do it first. Eschew the laser, I didn't say screw, eschew the laser procedure on your pelvis and the laser ablation, and try natural progesterone. Try these other options first. Why not? What do you got to lose?
Doesn't hurt.
Yeah.
Someone was
Read
asking.
my reviews on YouTube, on Google, and see all the endometriosis cases have helped.
Yeah.
Like 8 bazillion of them. I don't know if that, maybe
8
4.
bazillion.
Okay, maybe I don't know, maybe 12 left to review. I don't know.
So this lady, she's new to your page. She's wondering, do you work with people outside of Utah?
All the time.
And how do they do that?
Just set up an appointment. We can deal with it. If I need to write your prescription, you'll eventually have to fly in here and see me, but we probably won't.
With this route, you don't need it.
You mostly don't need to, yeah.
How is endometriosis mostly diagnosed or best diagnosed?
You have crazy heavy bleeding during your cycle, lots of pelvic pain, all that. It's endometriosis until proven otherwise. What is it? A UTI? No. What could be something else? Appendicitis? No. No, it's endometriosis. There aren't a lot of options if you're having agonizing pain all the time in your pelvis and even before and after your cycle, and your cycles are a nightmare. That's endometriosis.
Gotcha. How much progesterone do you recommend for the regular endo people? Not the severe kinds, because you said like severe ones take 8 to 12.
Oh, 8 to 17,
Yeah.
18.
What
I
about?
had them take 20, which is crazy. That's like,
That's
you know how
wild.
expensive that is?
That's thousands
And
of
that's
dollars.
me using cheap Utah compounding pharmacy is really good, by the way. 1 to 5, maybe at worst 7 occasionally during your cycle, but usually it's 1 to 5, usually 2 or 3.
Yeah.
And you take them all the time and bump them up during your cycle. Sorry, that's just the best way to do it.
Mm-hmm.
I don't believe in cycling. Take them 14 days and 14. Oh, I don't do all that. I'm just going if you figure this out, Mabel, I'm giving you this prescription. God be with you, and say your prayers and figure this out. You and your husband, how much you need and how often you need it, when you need it, and I'll guide you as I can. Because everybody's different. Well, every body is different. Sorry, keep whacking them. Got all excited there. So every body is different, and no one's the same. There's no blanket way to prescribe progesterone. Just take it, figure it out. It might take you 3 to 6 months, but eventually you and I have this talk where you go, oh my God, this stuff is incredible. I'm giving you a 5-star review on Google. I love you. If I do have any pain, I put some Ceramax down there. God bless you, Dr. Bursher. We're naming our next 3 kids after you. I'm like, that'll be weird, but okay.
Oh boy, you wish. He's
3
been
Danny Pursers,
Yeah.
just right in a row.
Danny Purser.
Doesn't matter the gender
Not
or anything.
Junior,
No,
1,
no.
2, 3, just Danny Purser.
Just Danny Purser.
You guys are harassing me.
You're
Son of a-
harassing yourself.
You're harassing your patients
Yeah.
by forcing them to name their children after you.
That's a stipulation, by the way.
No,
guys.
it's not. He's going to get my license if I shut up. Okay.
I don't know how to say this word. Adenomyosis.
Adenomyosis.
Yeah. Is there any correlation to endo and?
Yeah, it's almost the same thing, isn't
Okay.
it?
I don't know. I've never
I get
even
them
heard that word.
confused, so they're not that different. Yeah, treat them the same.
Okay. There you go.
I guess I should have said that, right? That's kind
Yeah.
of a cooler way to say endometriosis.
I-
Adenomyosis. You go in the room, have your clipboard, wear have your white coat on, a little stethoscope around your neck, none of which I do. I'm like, Mabel, you have adenomyosis.
Everyone's Mabel.
Who is Mabel?
Yeah.
Why does she have 3 Danny Pursers as children?
And she has adenomyosis.
Mabel is just plagued. She's like Job. Like Mabel has every disease.
Everything.
She has 3 Danny Pursers, which is the worst plague of all of them, if we're being honest with
They're all
ourselves.
super smart little babies.
Yeah, just well, I mean,
Her
look at
husband
the
may
size of
not
the
like
head
them
though. That would be
named
terrible.
after her favorite doctor.
Oh my goodness.
You guys leave me alone. I'm gonna bring it. You know, there's another crew down the street I can bring in next time.
Sounds good. Good
Can't replace
luck.
me.
Yeah, he just is over there.
I'm the only one that knows how to do this.
He really does. We've been going back and forth on the camera. It's been me and you. It's been fun to see.
Yeah, finally they wonder maybe that talking voice was
It's
working.
me.
Okay, any other questions?
One more. Is endometriosis hereditary? I think that's an
Oh
interesting
yeah.
one.
Well, I just told you it's probably genetic.
Yeah.
Heck yeah.
Yeah.
Yeah, your mom's got it. Does your mom?
Mine.
Okay.
Am I allowed
We
to
were
say?
married about 3 or 4 months, and your mom's like, you know, I have endometriosis. I'm like, what? She told me she had fibroid, and she said, I have endometriosis. Like, wait, what? Because she'd heard me speak about progesterone. She said, I need some of that stuff. I'm like, what stuff? She said, that stuff you were talking about to all those doctors today. I'm like, and that would be, she said, the progesterone, I need some. I'm like, okay. I had a friend write for it. I don't write for my family unless I absolutely have to, and it's emergency. It's some antibiotic maybe. And the first day I said, how you doing with it? Good. You're taking one, right? Yeah. A little week later, I checked on her again. And I said, you're probably on 2 now. Do you like it? How many are you taking? She said, 7. I'm like, what? She said, I have endometriosis. That feels really good, and I'll never quit taking 7. She took 7 for a long time.
Yeah.
Now she takes like 3 or 4.
Mm-hmm.
Yeah.
It's crazy.
Yeah. Didn't see that one coming.
No.
When we put the rings on.
That's so funny. One more. This will be available for replay, so you guys can watch this again and again.
Oh, thousands of times you want to watch.
You can always learn from it. Take your notes.
Are you going to put links in there?
Yeah, I was putting a couple, but I'll go back and answer some questions for you guys. Sorry.
Did you pick the best 3 yet? You'll do that tomorrow?
Yeah, I'll announce you the best ones, and we're also going to be doing a 60K giveaway, so keep an eye out. Tomorrow we'll probably do another video with Dr.
Because I have 60,000 followers
Yep,
now?
60,000 followers here on Facebook, so we want to do something to celebrate you guys.
I've hit 60,000 before, but that was like years ago.
I don't think so, but
60,000 is pretty cool.
that is amazing.
Because you're all very loyal. And I've got you all hypnotized in believing I know something.
Got him hypnotized.
Don't know much.
Mabel specifically.
Mabel.
She's been under your transfer
Is there
for
a
20
Mabel
some
out
odd
there?
years now.
Mabel, ask the question, Mabel, so you can win the prize.
If anyone named Mabel is watching this
Come
right
forward.
now, comment and you will be a guaranteed winner.
Yes. Mabel, come forward. We got to see your birth certificate, too, to prove it.
Her name is Mabel. Well, she's on Facebook as a Mabel. She probably is.
I'm sure there's a Mabel out there.
I guarantee there is one. I don't think I've ever met one, but...
He's never met one, but it's always the name. It's hilarious.
Okay. That's it. We're done.
That's
I
it.
tortured these poor women enough.
Mm-hmm.
I love you all. Thank you for listening. 2 weeks. I have no idea what we're going to do Facebook Live about. Should be something really
Comment
cool.
something fun, guys. Let's see.
Yeah, give us some ideas. What do you want to hear about?
Wait, this lady said I have a cow named Mabel.
That is not. Does she have endometriosis, though? Is she a cow? No, never mind. Let's not
Love
go
that.
there. That's just really bad. Okay. Making me laugh, cracking me up. Okay, I love you all. And you're going to give away something for 60,000 fans?
Yeah.
Okay, well.
Love you guys. Thanks for coming.
Okay, yeah, thank you, and God bless, and go in good health.